Salutations, everybody. Dr. Ryan here. I'm a board certified specialist internist. Thank you so much for joining me, even as we're looking at a head to toe clinical examination approach to a patient who has hypothyroidism. If you haven't yet subscribed to my channel, I strongly encourage you to smash that subscribe button so you don't miss any exciting new content on this channel. Okay, guys, as usual, first up, you want to just step back and introduce yourself to the patient. Hello, sir. Hello, ma'am. I am so-and-so. Position the patient, usually fowlers or semi-fowlers, and obtain adequate exposure. Then you just want to step back and look at the patient, right? Are they overclothed, implying cold intolerance? Are they shivering? Are they confused, which means abnormal mental state, right? Are they pale? Is there vitiligo? Is there keratinemic tinge? Because you know that hypothyroidism leads to keratinemia, and a way to distinguish keratinemia from jaundice is that jaundice affects the mucosa but not usually the skin, right? Or actually it does affect the skin, I beg your pardon, but keratinemia doesn't affect the mucosa, just the skin, right? Vitiligo, why? Because autoimmune conditions stick together, and hypothyroidism, usually the pathophysiological basis is autoimmunity, right? Pale, because hypothyroidism causes a macrocytic non-megaloblastic anemia. Hands may be puffy. Look for xanthomata. Look for Tinel sign and wasting. Tinel sign, why? Because of carpal tunnel syndrome, right? Compression of the median nerve at the level of the flexor retinaculum because of the lipopolysaccharides in hypothyroidism. Right? In terms of the pulse, the patient may be bradycardic. You check for hypothermia in terms of the temperature of the skin. Is the patient hypertensive? Classically, you have diastolic hypertension and hypothyroidism, but you can also get systolic as well. Orthostasis, which is what we term Schmidt's sign. Right? Is there proximal muscle weakness, pectoral and pelvic girdle involvement? And the history of this is that the patient complains of difficulty hanging up clothes or combing their hair or walking upstairs or waking up from a seated position, hairs, stairs, and chairs. You know those deals right there. Percussion, mixed edema as well. Moving on to the neck, there might be a thyroidectomy scar. This patient may have had a thyroidectomy before, right? You may have a Schwarzschild sign. If there was a thyroidectomy before, they may have primed the parathyroid glands, and the patient might be hypocalcemic, which will manifest with Schwarzschild and Trousseau sign, etc. Is there goiter? Is there sternal dullness, implying retrosternal extension? Is there Pemberton sign? We discussed this in the video on hypothyroidism. Is there stridor? Is there hoarseness, implying that that huge goiter is now compressing the airway, compressing the recurrent laryngeal nerve, causing a very hoarse voice. In the eyes, you may have arcus senilis and xanthelasmata, which speaks to hypercholesterolemia. Exophthalmos, if there was previous Graves' disease. Periorbital edema, and you may have a visual field cut. Right? That's right. So then, in terms of the face, you may have, and the hair, the scalp, you may have alopecia, very coarse hair. You may have hair on the pillow in the mornings when they wake up. Loss of the outer third of the eyebrow, something we call Queen Anne sign. And some texts say that the patient actually looks like a toad-like faces. We'll have a look at that, but it's not very nice to mention that in your notes, right? Who wants to be called a toad? In the mouth, you may have mucosal pallor and glossomegaly, right? Which is basically a big tongue. Some people call that macroglossia. In the ears, you may have deafness on the back of nerve or conduction deafness, right? The patient may have gynecomastia or galacturia. Right, in terms of the heart, you may have a pericardial rub because hypothyroidism can cause pericardial effusions. Right, you may have a third heart sound, soft heart sounds, and a pleural effusion, so serositis. Right, is there ascites? Nice to ask. Once again, proximal muscle weakness of the pelvic girdle, pretibial mixed edema in a patient who has prior Graves' disease and peripheral edema, and often if this is mucopolysaccharidosis, if this is mixed edema, then it'll be classically non-pitting edema, right? One of the most important things is the hung-up ankle jerk, so delayed relaxation phase of patellal reflexes. Sometimes if you have absent ankle jerks, that speaks to B12 deficiency. But remember the telltale signs of B12 deficiency, 2 P's in a pod, right? The 2 P's speak to pyramidal column affectation, posterior column loss, peripheral neuropathy, optic atrophy, and dementia. So classically what you get is absent ankle jerks, but you get brisk knee jerks. Right? Absent ankle jerks on account of the peripheral neuropathy and brisk knee jerks on account of the pyramidal tract involvement. Then they may have a cerebellar type gait. Whew, that was a lot, guys. So important questions to ask, if you suspect that your patient may have hypothyroidism. On history, have you found cold weather more difficult to cope with recently? That speaks to cold intolerance. Have you had any problems with constipation, so your bowel habit is abnormal? By constipation, we mean passage of infrequent passage of stool, at least or at most 3 per week. Right, and its consistency is often hard. Have you gained weight recently? Have you noticed your skin has become very dry? Do you think that your memory is not as good as it once was? Have you felt depressed? Do you think your voice has become hoarse? Typically, hypothyroid speech is characteristically slow and nasal and occurs in up to a third of patients. Have you noticed swelling in your legs, which speaks to myxedema? Whoops. Okay, and the Good Signs Guide from Tally tells us these are probably the most reliable signs in the setting of hypothyroidism. In the skin, looking at coarse and dry skin, cold palms, dry palms, periorbital puffiness of the wrist, loss of eyebrow hair. So the speech is hypothyroid speech. You may have a goiter and you may have bradycardia when assessing the pulse, right? So this is just showing us the thyroid and goiter. So a normal thyroid, so you have a laryngeal prominence, which is the Adam's apple. You got the cricoid cartilage, and you got a straight line down to the suprasternal notch. Look, nice straight line. But here, there's Adam's apple. In a patient who has goiter, this line, which is between the cricoid cartilage and the suprasternal notch, bows outwards, and that means you probably have a goiter. This is the myxedematous facies. They say toad-like facies. Not nice to say that, right? But you can see the skin is pale already. And this is classic myxedematous facies. All right. This is just assessing a patient with a goiter, a patient thyroid from behind while the patient swallows a sip of water. Right, and you notice that if the goiter moves upwards on swallowing, there's probably a thyroglossal cyst or something in the midline pulling it upwards. But you should feel it actually move when the patient drinks water. Right, this is massively enlarged thyroid. This is goiter here, you can see, and this is, right, so large here and massive in this particular photo. Now, this is one of the most important signs to elicit the so-called hung reflexes of hypothyroidism, which implies a delayed relaxation phase, right? Look for rapid dorsiflexion followed by slow plantar flexion after the tendon is tapped, best illustrated with the patient kneeling when he's striking the Achilles tendon. This neurological associations with hypothyroidism, there's a whole host of these. The most common is entrapment symptoms, and then we have carpal tunnel and tarsal tunnel, delayed ankle jerks, like we mentioned, muscle cramps. Uncommon is things like peripheral neuropathy, proximal neuropathy, hypokalemic periodic paralysis, cerebellar syndromes, psychosis, coma, unmasking of myasthenia gravis. They keep company, right? Cerebrovascular disease, high CSF protein, and nerve deafness. Okay, my friends, the book of 1 Corinthians chapter 10 verse 31 says, so whether you eat or drink, do it all for the glory of God. Now, Paul would say, when he was admonishing Timothy, he said, look, all things are permissible, but not all things are beneficial. Right? So even though there are some things which are not necessarily sinful, they don't necessarily benefit you in any way. Right? So be careful. Everything you do it all for the glory of God. Even the way we spend our time, the way we interact with people, whatever we eat and drink, the way we go about our daily lives, does it bring glory to God? Nice to ask. God bless you. Have yourself a fantastic day. I'll see you soon with another helpful video on this channel in this series. God bless you.